Hi, it's Dr. Jim again. Thanks for tuning in. My topic today is dementia and agitation, a quick review of non-pharmacological interventions. Now, most experts agree that the first line approach for the management of agitated behaviors in older adults with dementia includes non-pharmacological strategies, not jumping to prescription drugs, but using things like exercise, reorientation, validation, and sensory stimulation to produce calm. Once interventions like these have been exhausted over a lengthy period of time, the use of mild psychotropics might become necessary. And that's a clinical call that you're going to have to make. It's a quality of life call, clinical call, so on and so forth. Since research has shown that both approaches have similar effects, except non-pharmacological interventions have lower risk of adverse events. Professional caregivers and those caring for a loved one, even at home, should become familiar with as many non-medication-based interventions as possible. So, dementia and agitation, it's like peanut butter and jelly. That's all there is to it. Over 50% and up to 80% of nursing home residents have some type of dementia, the main one being Alzheimer's disease. And then we probably have a mix of post-stroke dementia, cardiovascular-induced dementia, frontotemporal, and so on, Parkinson's-induced dementia. Agitation is probably going to be a part of the clinical picture at one point or another. It's going to be mixed with depression, anxiety, repetitive questioning, wandering, hopefully never elopement, because that means they got out the door. They're not wandering in the building anymore. They're out the door and down the street. Aggressive behavior, socially inappropriate behaviors. There are many ways to describe agitation. But if we really break agitation down, there are really four components to really strip it down and simplify it. We have physically aggressive behaviors, kicking, pushing, grabbing, hitting. Physically non-aggressive behaviors like pacing and restlessness. So it's good to know exactly what your resident and what the senior is exhibiting before doing anything. Verbally aggressive behavior means swearing, screaming, making violent threats. And then verbally non-aggressive behaviors, asking for attention, over-talking, complaining, being negative, groaning, and making other noises. So dementia, agitation, they're like peanut butter and jelly, but they're not so sweet and they're not so satisfying because they can really disrupt the senior's quality of living as well as the quality of living for other residents around that person in the building and the staff as well. So the best medicine is always prevention. Preventing behaviors. So if you see these verbally aggressive, physically non-aggressive, intervene in a very calm manner, try to distract, offer something to eat, something to drink, going for a walk, going outside. That's all prevention. And that means calming. The best thing you can do to calm a senior who has dementia and they're agitated is for you to be very calm, use a low tone of voice, don't maintain constant eye contact, just a little gentle, loving eye contact, a little gentle, touch on the shoulder, so on and so forth. You seem to be lost. Let me, grab you by the hand. Let's go for a walk. I know where you live, so on and so forth. And by doing that, you're really building trust with the senior. So your calming presence and using words and therapeutic touch to convey that you are the person to be trusted will make a huge difference. While you're doing that, watch for triggers in the environment. Are other residents upsetting this particular resident? Is it too warm? Is it too bright? Is it too cold? Is the environment too overstimulating, like at shift change? You have first shift communicating and clocking out. Second shift is coming in and getting ready and clocking in and talking and blah, blah, blah. So if that's a trigger, maybe maneuver the resident to an area where there isn't as much stimulation prior to it taking place. Okay, get as much training as you possibly can. I have two wonderful companies that provide lots of training. Collins Learning and CEU Academy. Check them out. And if your company's not using one, you should definitely look into them, okay? Use various therapies to calm them down, like pet therapy, exercise, hobbies and crafts, music, art, food, drink, light touch, validation. There's so many different things that you can do. So before jumping to the medications, try to use as many non-pharmacological interventions as you possibly can. There are a lot of heavy rules and regulations out there. There are a lot of agencies that are overseeing things like this. You don't want to get in trouble. But beyond that, this is for the quality of life of that senior. Do all of the things that you possibly can to provide prevention and calming and creating good quality of life in a wonderful atmosphere before ever going to medications. One day meds might be necessary, but until then, do absolutely everything you can to help. My name's Dr. Jim. Keep coming back for more good, hopefully good, information. Thank you so much for taking some time to watch the video. I appreciate it. And if you're a licensed healthcare professional who's looking for some great continuing education, we've got it. And we are always working on brand new, fresh content for you. So you can find the link to the website in the description and keep coming back for more information. I hope to see you soon.